Cool. All right, well, I'm Ashley Knapp. I'm a research assistant professor at Northwestern University that has the pleasure of working with most folks on this presentation. And it's been really fun. You guys were rad. That was really neat to see what everyone's working on, especially nowadays where we're also spread out. So today I want to share a program of research that emerged from my KO1 grant or my KO1 project. And it really has two focal points of community engaged research and digital mental health. All right, so before I get into the project as well as the results, I want to talk about adolescence and why this is such an important developmental period to both study but also implement digital mental health interventions. So adolescence is characterized by considerable biopsychosocial development driven in part by complex bodily changes related to puberty. So for example, in a relatively short amount of time, youth reach skeletal maturity and develop primary and secondary sexual characteristics. And along with this rapid growth in physical health, we also see the emergence of cognitive competencies such as mental health reasoning. And so what I find interesting, and a lot of other people are not alone, is this paradox though. So we have this, this emergence as well as this development of physical and physical health as well as cognitive competencies, but then it is also met with enhanced risk. And it's also been called a core risk period by some scientists in that psychological vulnerability is transformed into clinically relevant psychopathology. So for example, anxiety disorders are one of the most common classes of psychopathology. Sorry, I was looking at my time, making sure I knew what it was. So let's see, anxiety is one of the most common disorders among this developmental period. And what we know is anxiety disorders, they negatively impact functioning, so like school performance, physical health, and also increased risk for additional or other psychopathology. And in addition to the increased vulnerability of this period, this generation of teens or adolescents have been deemed digital natives because they've grown up immersed within and surrounded by technology. And so what we know from Pew Research Center and other folks that have studied this is that there is nearly ubiquitous access to smartphones among teens, 12 to 17. And this is even across genders, race, ethnicity, and socioeconomic status. So this rapid emergence of digital technology use among teens suggests that this may be a promising modality through which to reach and engage vulnerable youth. However, when we look into the digital mental health literature, we see this substantial research to practice gap in that it takes a substantial amount of time from intervention testing to deployment in real world settings. So for example, we see hundreds of randomized control trials for digital mental health interventions. They've consistently shown efficacy and effectiveness. However, attempts at real world implementation of those interventions have failed. And let's see, and how I actually describe this to the teams I work with or even some stakeholders is, so more layman terms, us researchers think we know all of the things, and then we create an intervention based on all of our vast knowledge, but then we scratch our heads whenever there's not uptake that we think should happen or not the clinical outcomes that we think we should see. And one reason that a lot of folks at CVITS and Northwestern we've been thinking about is that we as researchers, we've traditionally used a top-down approach in the design of mental health tools, and in which we decide the main themes, the main topics or the targets, and then we use technology to try to persuade users to do what we'll believe to lead to improvement or and also engagement. And this approach, however, doesn't consider how people use technology, how they engage with technology, their own personal goals around technology use, and also the context in which the intervention is embedded. And typically, interventions are also not tested in environments in which they'll be deployed. So the interventions traditionally just haven't been optimized for use in real-world settings or to fit within the lives of people. I always want to have a fun slide. So we've all probably watched weird things over the pandemic or gotten into shows or movies. Mine was, I went into the Alien series. And so here's a clip from Prometheus. Came out in 2012. I think it's a spoiler, but here's my example. So this is Elizabeth Shaw, with her back to us, and she has been impregnated by an alien. And she's going up, the scene is where she's going up to what's called a med pod, basically an electronic surgeon. That's that contraption you see right here, that's white. And and the med pod says to her, please verbally state the nature of your inquiry. And Elizabeth says, I need a cesarean. And then the med pod responds, this med pod is calibrated for male patients only. And I, to the detriment of my partner, I had to pause this and go on a soapbox about how this is what we're doing with the top-down approach. And and a reason of why we need to have users engaged in the process of designing interventions and testing interventions and ultimately implementing interventions, because we're just going to have these blind spots, or we're just not going to have these different perspectives. So even though it's a silly example, I think it's a pretty good one of just showing how we can have these blind spots if we don't include the users or the stakeholders in the development and testing of interventions. All right, so now we'll chat a little bit about the goal of this project is to design a technology-enabled prevention service. And the two big focal points are partnering with a community organization that serves youth, and then also includes adolescents and other stakeholders in the service design. And specifically, the technology-enabled prevention service is targeted for teens. So, and then the ultimate goal is to design a widely accessible and available service co-designed by teens and community partners to reach and engage large population of youth. So the partnership that I have is with a local Chicagoland library called Oak Park Public Library. And when I was writing the KO1 award, or the submission, and chatting with my different mentors, I was introduced to a director at the Oak Park Public Library, Robert Simmons. And I set up a meeting with him and the executive director at this library. And as we started chatting about goals or focuses of our work and what's most important to us, it became really apparent how overlapping our pursuits were in serving the mental health of teens. And specifically, it became apparent that the shared common mission of provision of accessible and evidence-based mental health resources to Chicagoland youth. And if you're like me, this took a step back. I was like, what? Libraries? They do more than just improve literacy and provide books. And that's what's kind of neat, is there's a big movement in Chicago, and I imagine other cities as well, where libraries are starting to think about and provide services, social services for their patrons. So this came out, the Chicago Tribune article, a couple of years ago at this point, but I think it depicts this movement well. So it's the title of the article's Homeless People in the Library, Chicago Suburban Libraries Turn to Social Workers for Help. And one of the directors of a library in one of the Chicago neighborhoods was quoted in this article saying, "We started looking at patrons in a different way, that maybe some of the behavioral issues we were having at the library were stemming from other needs we could address." And so it just kind of underlies that terminology that I learned, patrons are those folks who use the library services. And so what I learned from them is they're meeting the needs of patrons above and beyond literacy and provision of resources related to books and things like that, which was pretty cool. So I always love to give a shout out to my fabulous community partners. So from left to right, there's Robert Simmons, Stephen Jackson, Darcel Washington, and Alex Gutierrez. And Robert Simmons is the Director of Social Services and Public Safety. And then Stephen, Darcel, and Alex are kind of boots on the ground, are really involved with the teams and the team services. And actually, Stephen just got a promotion to director, so woo, I need to change that on my slide. And so they, the teen services, they have a program called Leading Edge, and it's their teen services program name, but it's really neat because it's designed by teens and it's for teens, but also teens have a large part of their development, and they actually just got a teen space in the library. That was a big thing that they've accomplished. But they not only serve teens within Oak Park or within that suburb, but they really serve teens from all the different neighborhoods around Oak Park, and some of those neighborhoods have underserved teens or teens from low socioeconomic households. So they have a really big reach around Chicago. So I want to go just a little bit into the project overview and then chat about some hot off the press preliminary interview results. So here is a diagram I put together for, I believe it was the for the submission of the grant. So it's pretty detailed, but the blue circles, those are the major methods that we used and where we collected the data. And then the yellow, I guess they're mostly rectangles and squares. Those are just the data analysis and refinement. So I'll go over each of them, but a big part of this project is the inclusion and involvement of the user. And in this sense, teen patrons or youth and library staff. So I think in Emily's talk, this was chatted about a lot, so it should be familiar, but it's iterative in the sense of the information that we're collecting at the stage prior, we're analyzing it, making prototype adaptations, and then testing those prototypes based on the information we learned at the previous stage. So we are just at the beginning. We just completed the needs assessment interviews, and that's the data I'll chat about. Next we have up is design workshops, and then we'll go into analyzing that data, making probably wireframes or some low fidelity prototypes that can be tested. It says in the lab, but it will be at the library. And then we'll just keep doing that iterative process of stakeholder feedback, prototype refinement, and then field testing or in the wild, and then pilot testing. Oops. All right. So Emily and I and others have been really hard at work at coding all of this interview data. So let's see. So I'll first chat about both our needs assessment interviews. The first results that I'll chat about are with the library staff, and then hopefully I'll have time to chat about some preliminary results with the teen patrons. So with the library staff, I'm generally excited about research, but I was super thrilled about this because we were able to get interviews with folks at all different levels and all different levels of the library. So we had interviews with board of trustees, the executive director, directors, managers, librarians, and other staff. So it was really neat just to have such an array of perspective and then also cultivate relationships with each of those folks at the different levels. So take a second and drink water. All right, so the interview questions were primarily around what's their role, what's their workflow, what technologies do they use, what's the current support of youth mental health, how confident are they in responding to youth mental health concerns, what are their desired resources and integration considerations. And for these interview transcripts, we coded them using a thematic analysis approach. So just for time's sake, I'm going to focus or hone in for these interview results on desired resources and features. And so some themes that came up within the desired resources and features were pretty regular or consensus around the content and type of digital or mental health resources that they'd like to see in the library. They had really fabulous ideas on implementation considerations. So how it could, how this service could be implemented or folded within within resources and programs they already have. And then accessibility was also a really big topic chatted about. So I'm going to show you different quotes for each of those. So for the content or type, so I'll read this quote. Yeah, whether it's a physical space, a list of mental health professionals, or a crisis hotline, or who knows, but a library's resources are no longer just books and microfilm, and we are looking at things in a new way of how we provide services versus directionally to lift them up. And perhaps that lifting up is not just a matter of literacy, it's a matter of other well-being. And them is just chatting about the patrons of the library. And I really like this as the first quote, because I think it underscores the Chicago Tribune article, but just highlights the movement in Chicago libraries to go above and beyond literacy and provision of books, but also support and the general well-being of patrons. And then chat about some different ideas of list of professionals or crisis hotlines. And so another theme that around the content and type that really, builds upon this quote is there was a lot of talk about the library being a conduit or a bridge to patrons to resources that the patrons can then use. So I heard a lot of that would be like a repository of digital and other mental health resources. And as you can see here, the crisis hotline, the professionals, but also skills built in real time, coping skills with stress and anxiety. Right. And so then with also the content and type came implementation considerations and really fabulous ideas. And I know this one is a little longer. So I'll go ahead and read it. Well, one thing that came into my mind was we do have a resource that's essentially like a paper resource, like a bookmark, that is sort of a doing numbers of difficult topics like pregnancy, drug use, things that it's sort of like the surreptitious way for teens to be able to find materials that they really don't want to ask the person at the desk about, but we have it. Like, here's some difficult issues that you might be dealing with. Here's where you can find them. You don't have to feel free to ask a staff member, but just sort of having a quasi cheat sheet to find things that are difficult topics to talk about. Having a resource like that would be with digital suggestions would be something to consider, I think. So not just books, but here are places you can go when you have questions about XYZ. And here are the websites you can go to. Here are the apps that might be helpful if you're experiencing these issues. So what I loved about this was it's for this repository of mental health resources, there's already something within the library that we can fold into the service that we'll co-create, and especially overcoming the stigma that typically is with mental health. And so the teens can access it anonymously, or folks behind the desk or those that interact with teens can have something and be prepared to share these things. So I'll share one more quote, and I actually won't get to teen results. So you can, I love talking to people about research, feel free to reach out. But one more is just accessibility. So I think a variety of options is best. So sometimes one might find themselves in an environment where a web-based tool would be the most appropriate to use, but other times it might be a mobile app on a phone that is that the situation that they find themselves, that's just an easier, quicker way to access the information that they need. So this speaks to just the accessibility. It was really important for the library staff that the service that we could create be accessible via multiple platforms suggested by this quote. And also, I remember mental health literacy was large as well in the accessibility. So in a format that is tailored to teens. All right, for sake of time, yeah, let's see, I think I'm just going to say thanks because I've chatted everyone's ears off. But again, I love chatting about research. Reach out. I love meeting new people and making collaborations. There's my email, and also I am trying to get better at Twitter. So please follow me on Twitter, and we can learn all the cool research that we all are doing.